At Memorial, we are deeply committed to developing the talent and skills of our new graduate nurses. To support your transition to the professional nursing role within our Magnet-designated organization, we are excited to provide you with a nationally recognized Nurse Residency Program. The program curriculum focuses on the 3 core components: clinical leadership, patient safety and outcomes, and the professional role of the registered nurse. As I'm sure you know, your nursing education doesn't end at graduation. Throughout your career, you'll continue to build your knowledge, gain confidence, and acquire the skills you need to provide exceptional nursing care to your patients and families. Participating in the monthly residency sessions provides you with a strong foundation for the lifelong learning ahead. As Memorial's Chief Nursing Officer, I'm extremely proud of the amazing work of our nurse residents. Their efforts continue to push us forward in our quest to raise the bar of nursing excellence and to provide the best nursing care possible to every patient, every day.
The program is designed for every new graduate nurse so that they don't have any extra applications or requirements to participate. Well, typically nurses build their critical thinking skills and their clinical judgment through working with patients and talking with physicians and interacting with family members. But that takes time. And so through the Nurse Residency Program and access to our amazing Clinical Simulation Center, we're able to utilize patient simulation to really help nurses delve deep into patient cases, to think about the lab work with nurses from all these different parts of the organization, from the ED, FMS, ICU nurses, med-surg, and they all contribute and work through these clinical simulation cases to understand the clinical intricacy. Memorial has a really strong culture of learning and of innovation. So to foster that in the Nurse Residency Program, we designed the last 6 months of the program to be committed to an evidence-based practice project. So what nurses do is they get into groups and they work with their unit manager, and think about what clinical issues are they seeing as problematic or an opportunity to improve. And so through that, they often develop a unit-based initiative to improve care. And we've seen excellent outcomes from that at the unit level, and even then taken it further into some of our other house-wide councils and committees and even throughout the health system to make improvements that have really had a lasting impact on the way we care for patients.
I think the most important thing that I learned in the Nurse Residency Program was honestly that I'm not alone, and that there's always another nurse, a leader, a mentor here to help you. I learned so much about patient care, the importance of evidence-based practice, and using the resources that are provided to me here to better my practice and really strive for patient safety and good outcomes.
I've utilized what I've learned in the Nurse Residency Program in practice. It just gets you comfortable with the clinical setting. You know, it's a month-by-month thing. You might work for a few months and then you come back and you have all these good discussions with your peers about experiences, and it just helps you grow and become more familiar and comfortable in the patient care setting.
I think that what I love about this program is that it really helps nurses to see themselves a little bit differently than they might coming out of school. Initially, you're so focused on your clinical expertise and clinical care and your comfort in taking care of patients within this interprofessional team. And certainly they get that experience at the bedside with their mentors, their preceptors at the unit. But the residency program helps to really round them out and help them see themselves more so as professionals in this workforce that we have taking care of patients. And by developing their professionalism, their communication, their collaboration skills, their ability to really work within the healthcare team, I think that that really elevates them as professional members of our nursing workforce.